A PNP is a pediatric nurse practitioner.
We can diagnose, treat, prescribe, just like a doctor would, but with the touch of a nurse.
Kids A to Z with the PNPs. E is for enough.
Hi everyone, welcome to Kids A to Z with the PNPs.
Where each week we take a closer look at some of the common health problems affecting our kids.
We're your hosts. I'm Dominique.
And I'm Courtney. And today we're going to be talking about the letter E. And E is for enough, or what happens when you don't have enough food to get you through the week to feed your family.
Today we are lucky enough to have two guests with us, Dr. Hyder and Dr. Hunt.
Hi.
Thank you for coming.
Thank you.
They are our leaders in our food insecurity task force here at the hospital.
Yeah, so we are going to do something a little bit different this week and kind of interview them and talk to them about what is food insecurity? What does that mean?
So food insecurity, it sounds like a really big word for being hungry. So is there a difference between being hungry and being food insecure?
Yeah, that's a great question. So hunger is really kind of obviously the feeling of being hungry, and many of us feel hungry various times throughout the day, or almost everybody has felt hungry at some point in their life. But food insecurity is really the concept that you don't have consistent access to food. So whether that be because you run out of money at the end of the month and you don't have enough to buy food for your family, or you just simply run out of food, that's really what food insecurity is. People can be food insecure for many reasons. If you have kind of hungry boys, teenage boys that are eating all of your food, or little kiddos in your home that are snacking a lot, you could have run out. So the lack of consistent access to food is really the concept of food insecurity, and it's a much more broad term to describe something beyond just how you're feeling. So that's the difference.
Yeah, and to add to that, it's not only about the quantity of food, but also the quality of food. So sometimes you have enough food, but you're opting to choose kind of less nutritious foods because they cost less. So sometimes it's not just about how much food you have, but also the quality of food that you're able to obtain.
So how prevalent is this in our area?
So specifically, like in the state of Michigan, about 1 in 6 individuals are food insecure. So that's a really high number. It's actually a lot higher than nationwide numbers of about 12% or so. And in Wayne County specifically, it's actually even more common. 1 in 5 individuals are food insecure. And as pediatricians, we really care about this because what we find is that households where there are children, there are more rates of food insecurity. It's higher. And also households that are run by single moms or single dads, there's also more food insecurity. So it's a lot more common than you think.
So what can families do if they feel like they need help putting food on the table? Are there any programs that are available to them we can talk about?
So the most easy thing for a family to do is to simply dial the number 211 on any phone. So 211 connects to the organization, the United Way, and the United Way is available not only through Detroit, but it's statewide and I believe nationwide as well.
Yeah.
So can simply dial 211 on any phone and it connects you with an operator, a person on the other end of the phone, and they can ask you some basic questions about where you live, what's your address, but you can remain anonymous. So if you don't feel very comfortable, then you can remain anonymous. You don't have to say your name, and they can give you resources to all the different food banks in your area or food truck routes, or specifically we're coming into winter time now, so people really struggle with warm places to sleep, resources for electricity or water access. And so the United Way can provide resources for all of those things. So it's really great.
So this is the 211 is not just for if you have kids, anyone can call this.
Anybody can call 211 and access. I think one other really interesting thing is that, we are doctors, you're of course nurses, and so many people watching this, not just doctors and nurses, but if you're a school teacher or if you're a family member in the community and you have somebody that's struggling in your house, you can simply call 211 with any problem that you have and they can help to get you resources. It's sometimes hard for us in clinics or in the hospital to know where, might there be a food truck route near your home. And so that's what 211 really helps with, is connecting you to the resources that are available in the community.
Yeah, it's a really awesome resource that I don't think a lot of people know about. So
Yeah.
thanks for sharing.
Yeah, it's really helpful.
So what are we doing at the hospital, to help identify these families that are in need?
So So I think the most important step to take is basically to ask about it. People might not know that food insecurity is so common, and a lot of times it's not obvious. So it might be maybe expected if a child comes to your clinic with failure to thrive, or if they're not growing well, you might expect that there's not enough food going around in the home. But sometimes it's not a skinny patient, it's someone who's obese, someone whose asthma is poorly controlled, whose diabetes is poorly controlled, who could do better with their depression. So it's very closely linked to that, and food insecurity doesn't really have a face. So essentially you can't just, you can't know if someone is food insecure without asking. So that's the first step we're taking, is that we're asking about it. And for pediatricians and clinicians, just look up the hunger vital signs. Those are just 2 questions that you can ask to identify if someone is at risk for food insecurity. And just like we encourage our pediatricians and physicians in the community to ask, we also want to encourage families and patients to open up about it, because there's nothing to be ashamed of, and it's very important to bring it up so that we can give you the resources that you need.
Yeah, for sure. And as we mentioned earlier, there are a lot of resources out there in the community, so hopefully people feel more comfortable as we begin to talk about it more and bring it to light, that you can talk to your doctors or talk to your friends or talk to your families. There are places that can help, 2-in-1 being one of them, but there are many organizations, wonderful organizations in the city, Forgotten Harvest and Gleaners and COPS, many different organizations, specifically in Detroit, but many things available in most communities. If you just ask, or we as providers ask, then people can get help.
Very important.
Yeah. Well, thank you so much for joining us today.
Yeah, thank
you.
I think we all learned a lot.
Yeah.
So next week, we will be talking about the letter F.
And the letter F is for fever.
Yes. So if you have any questions for us or for Dr. Hunt or Dr. Hyder, please feel free to comment on this post or shoot us an email at kidsA2Z@dmc.org. We'd love to hear from you. So we will see you next week with fever.
Thanks for watching.